Hey guys, hope you guys all had an awesome week again this week. Happy Nurses Week to those of you that are nurses and soon to be nurses. Everybody gets to celebrate this week. Bad connection, so it may have cut out. Anyways, so this week we are doing a special series or special episode of our series for Nurses Week, and we're going to be talking about Nurses Week gifts. We did a discussion on Reddit this past week or two, asking nurses what the strangest gifts they received for Nurses Week or the worst gifts they received. So we thought that would be kind of a fun topic to talk about. And since it's Nurses Week, we want to say thank you to all of our nursing students who subscribe to NRSNG and use our tools and really support us and have helped continue to help us grow. So this week we want to say thank you to you guys and kind of have this an open forum for this evening and kind of let you guys just ask any questions you have on your mind. We know that final exams are coming up and some of you might be studying for NCLEX, might be graduating. So we want to kind of leave this open for you guys tonight to kind of talk about whatever you guys want to talk about. So feel free to post questions below. Again, if you haven't done Facebook Live before, every time you guys comment, comments will appear down below as I'm talking, so I'll be able to answer questions as I'm talking and going. So feel free to type them in and send them, and I'll answer them as I'm going. And if there are questions that we have resources for, John's going to be watching and listening in on the other side on the computer, so you guys won't see him, but he will be there answering questions through the comments. He'll be attaching links and things like that you guys might find useful for the questions that you have. So as we're waiting for some more people to join us, thought I'd give you guys another link to a cheat sheet. So this week's cheat sheet is an order of lab values. I know that when I was a nursing student, I don't feel like I ran into it too much, having to draw labs and knowing which labs to draw first and in which order. But becoming a new nurse, it's something that when we did have to draw labs, which was rare, but when we did have to draw labs, it's important to know which labs to draw first. So this is a cheat sheet of which labs you should draw first according to their color and which labs go in which tube. So the link for that is www.nrsng.com/order lab values / So again, you'll just have to type in your email and you'll have that sent to you. So it's a really great cheat sheet. You guys should have that one up, whether you're going to work on the floor or working clinical soon. I think it's a really great tool to have. So go ahead and grab that one. So it looks like we've got our first question ready. I'm getting close to taking NCLEX. I'm getting more nervous as the date gets closer. Any advice for how to approach this? So everybody gets nervous about NCLEX, so you're not the only one. NCLEX is a huge struggle for people. We have tons of resources. I would definitely say to check out our blog on nrsng.com. There's some really great blogs. Maybe John can throw some links up there for you guys too, about just preparing for the NCLEX, great study tools for the NCLEX, and why it's not important to pass it in 75 questions. A lot of people hit that 75 question mark, and if it doesn't shut off and you know that you didn't pass after that, sometimes people freak out. You know what? It really doesn't matter if you pass in 75 questions. No manager, no patient is ever going to ask you, hey, how many questions did it take you on the NCLEX to pass? Or even, how many times did it take you to pass the NCLEX? Honestly, patients just care that you can take care of them and that you're doing so safely. Some people aren't awesome test takers, and it might take you more than 75 questions, and that's totally okay. So there you go. John just posted up how to dissect NCLEX questions. It's a really great blog post that you can check out just for getting more comfortable. I would also recommend going to, if you haven't already, our nursing practice questions. It's www.nursingpracticequestions.com. Super easy. It's completely free. It's got about 3,500 questions, and it's completely free to use. You can also target your struggle areas. So if you're struggling with OB-PEDS or if you're struggling with med-surg or pharm, you can specify that you want to work on those types of questions. So that's another really great resource that you can use. So there you go. There's the link down below. So as we're waiting for more questions to come through if you guys have them. Like I said, continue to post, and we'll kind of just talk Nurses Week. Oh, would you say it's better to focus on categories or the specialties? It kind of depends. Our nurses practice questions here, let me pull that up real quick, is pretty great in the fact that, let me move this around. It kind of focuses on the different topics. Some of the topics would be considered specialties, like cardiac is a topic in itself, but it's also a specialty floor that you can go work on. But then it also hits on all the different topics. As you can see, like fundamentals, OB-Peds, neuro. So I would recommend kind of hitting on all those main topics. A lot of these topics are what's going to be covered in or on the NCLEX. It also gives you a really great overview of different types of questions, like select all that apply and prioritization and things like that. So it's a really great resource for those of you who are getting ready to take the NCLEX soon. Yep, and HERS has been around for a long time, so if that's something you guys are interested in, feel free to look at that too. What was I gonna do? Okay, so we did a really fun Reddit post a couple weeks ago, just to kind of get an idea of different goofy things that nurses have gotten for Nurses Week. John and I were kind of talking, and we think it's kind of funny, like they do like big to-dos about Nurses Week, and they want to celebrate nurses, and that's awesome. And we know that admin, you know, have it in their minds that they want to do something great for nurses, and there's tons of us at a hospital, so we understand that they can't spend a ton of money. But some of the responses we got to our question on Reddit just really took the cake. We had one nurse who works in the Air Force, and he said that for a while they were selling donuts as a fundraiser to raise money for Nurses Week. So basically they were told to buy donuts or asked to buy donuts, but really kind of pushed to buy the donuts for $10 to kind of buy their own Nurses Week's gifts. So we thought that that was kind of funny. It looks like we got another question. So summer semester, week and a half OB-Peds. What do you think is the best way to approach clinical for this specialty? We don't have a ton of material on OB-Peds yet, unfortunately. We're looking at getting some experts in to talk about OB-Peds. As John, you know, worked neuro ICU. I did cardiac. The rest of our teams kind of did ICU, ER. So we don't have a ton of experience in OB-Peds. So we're hoping in a couple weeks that we're going to have a expert on this area come in and talk to you guys to give you guys a better understanding and can answer your questions a little bit better in this area, since we have never really specialized in it. When I did OB-Peds clinical, approaching the clinical, I didn't want to see childbirth. But that was my preference. Tons of people wanted to. I knew that if I saw it, that there would be a good chance that I'd never want to have my own children, which I have since. I have a 3-year-old and expecting baby number 2 now. So that didn't affect me at all. So I kind of wanted to stay more on the baby side of things. So I stayed in the nursery and the pediatric side. But it is important to study and to kind of know the basics. But they don't, at least in our clinical, they didn't let you get too hands-on with OB-Peds, just because it is such a specialty that you kind of watch and learn from the nurses a little bit more. At least that's the way it was in our school. I know every school is different, so you might get to be a little bit more hands-on in your clinical. Currently taking Kaplan-Cas, emphasizing to use the decision tree. Is that something you would recommend? It works for some people, the decision tree, when taking the NCLEX. Honestly, everybody learns in a different way, and we don't like to push you towards a specific thing. We think it's really important to know the material. It's important to know like test taking strategy, and that's what the decision tree is. You know, it's a test taking strategy that they teach you with Kaplan, and that's great. And some people need that because they really need the test taking knowledge and tips. They know their information, they know the material, but they might struggle on just how to answer those nursing type questions on the NCLEX. So for those types of people, decision tree can work great for them. Other people, decision tree, I've seen almost hurt them in their test taking ability. They were a better test taker before they went in, and then the decision tree kind of just confused them. So if it's working for you and you think that as you're taking a test and you're walking through the decision tree and that helps you, go for it 100%, you know, if it's helping. If you're seeming to get confused or you're answering questions and getting more questions wrong by using it, then I would try a different strategy. There's tons of them out there. And like I said, a lot of our blogs give a lot of tips on how to take NCLEX questions and how to dissect them, which is a link that John posted a little bit earlier. So NCLEX covers basic comforting care or psychosocial and psychological. How would you focus on peds or OB? I'm not exactly sure what that question's asking, Chris. I don't know if you're asking how to focus for OB peds. It looks like, there we go. It looks like John answered you down below, so he's got you there. If you have more questions, feel free to post them. Best way to calm my nerves getting ready for nursing school. It's normal to be scared for nursing school. I was super scared. I went in as a second degree student, and it's just it's a different schooling experience with nursing school. It's a lot. It comes at you fast, so I think it's completely normal to be nervous, but don't be too scared. Get excited for it. You need to be excited to kind of get yourself pumped up, and just take one thing at a time. Honestly, that's the best news, or the best advice I can give you is when you get in there, don't get overwhelmed by everything they're going to tell you, because you might get crazy like reading assignments for like 100 pages for just one class, and that can be really overwhelming for a new nursing school student. So I highly recommend just getting in and taking it one class at a time, one day at a time, one assignment at a time, and don't let all of the things overwhelm you at once. Just take it one thing at a time, and you'll do awesome. And we're always here to help. So if there's an area that you're struggling with or that you don't know how to work through, you can always email us at contact@nrsng.com and let us know your struggle areas, and we're more than happy to help point you in the right direction of some really great resources. So Jeremy, let's see, failed nursing class, school accepted back into the program next spring. For NCLEX, again, I would highly recommend for you to check out our blog. A lot of the posts we have, I think, will definitely help you prepare for the NCLEX. It's important to prepare for NCLEX all through nursing school, because that's obviously what you're kind of going towards in the end, is passing the NCLEX, but it's also important to sit down and really get the knowledge and gain the experience and just the material from nursing school. So again, just take it one day at a time, and just learn as you go. And if there's a trouble area or a struggle area that kind of feels like you're getting tripped up on, take some extra time on that. Make sure that you're not making the same mistakes that you made the last semester. You know, so if there's an area that you really struggled with, maybe focus on that a little bit more, or see if you can get some extra help. Best online school to get a BSN. I don't know if John can maybe answer that one for you on the back end, but Cynthia, I'm not too sure about the online programs. I honestly, when I went to nursing school, I didn't research too many nursing schools just because I stayed in my area. I didn't want to move away. I was getting married, so I kind of only researched schools in the area, so I'm not too familiar with different online programs, unfortunately. So that might be a question for John if he knows the answer. Sorry, just skimming through questions. Taking the NCLEX next month for Brianna. Any advice? I would just continue to tell you to, you know, take it one thing at a time, focus on your struggle areas, make sure that you know your material and your information. Don't get too overwhelmed by things. If you need to take a step back, if you're feeling overwhelmed or you feel like you're in a slump, take a break. Seriously, it is not worth it to stress yourself out. It's only going to make things harder to struggle for the NCLEX. You know, I've talked to a ton of people that have, you know, lost their focus, or they study and they stress themselves out so much that they just can't handle it. So If you need a break, take the break. Taking a break for a day or two is not going to make or break if you pass the NCLEX. I also say like a couple days before you take the NCLEX, honestly, if you don't know it by then, you're probably not going to learn it in the day or two before you take the NCLEX, at least not enough to like have it sink in and have it really in your brain. So take a couple days off before the NCLEX. You know, take some practice questions a couple days beforehand, but don't cram. So if you can, if you still have a couple weeks before you're taking it, you know, you said you have a whole month. So if you can, like, really sit down and schedule out which areas you need to focus on the most, and give yourself a couple days for each struggle area that you have, and really focus and hunker down on those. Take good notes, do lots of practice questions, and then as you get closer, try not to go over the material as much as you are just practicing the questions. You know, you'd hate to know all the material and then get stuck up on a question because you didn't take enough practice questions and you don't know how to answer those NCLEX questions. So that would be the best advice I can really give for NCLEX that I haven't already said already. I feel like I keep repeating myself, so let me know if I am. Failed fourth semester, is there hope? Gus, there's totally hope. We have tons of friends who didn't pass a class, got held back. We were in a cohort that we all kind of went through the program together, and we started with, I think, like probably close to 30 people. And John might have to correct me, but I know we didn't graduate with 30 people. There were some people that, you know, didn't pass a class or wanted to take a class over, or got held up because of other things in life. And you know, that happens. So sometimes in a semester you might have a teacher that you just really don't learn well from, and the next time you retake that class you might 100% just get it. Something might click. The way they teach, just, I mean, anything can change the way a semester goes. Even if it's the exact same classes, it can be just a different teaching style for the teacher, or it could be something that was going on in your life this semester that maybe you lost a little bit of focus or you didn't have the time to study. So definitely there's still hope. Retake whatever class it is that you need to, and keep going. You know, if nursing is your dream, then definitely don't give up on it. Sorry, still reading. All right, so Katie asked what the best way to prepare for a HESI test. Told the administrator at the end of each semester is supposed to help with NCLEX. So we don't have tons of stuff on HESI. We actually don't have anything in particular on HESI because we don't focus on that, but we do focus on NCLEX. And we do have actually a lot of students who email us letting us know that a lot of our material helped them on the HESI exams that they have to take at their school in order to, you know, get from semester to semester. So I would recommend checking out our NCLEX prep stuff. I think that it will still help you on the HESI because I think that they're kind of correlated. So if you know what topics it's going over, feel free to email us and we can connect you with some good resources. But I would honestly take some NCLEX practice questions and things like that to prepare for the HESI. I never took HESI myself, but I hear that it is a lot like NCLEX. We did ATI at our school, so, and I know that was a lot like the NCLEX, so we used a lot of NCLEX prep stuff. Oh, and Katie, John also posted, oh, we do have something. Sorry, I didn't know we had something on the HESI. So, yeah, go ahead and check out that link that John posted. Ooh, HESI's harder than NCLEX is what I hear. Interesting. Sorry, still reading. Ignore the mess behind me, too. We're getting ready for baby number 2, and my office has become a disaster zone. All right. Yes, Katie said, Janet, study, study, study. PSB tests, very similar. Studying helps a lot. So yeah, definitely study. And like I said, our NCLEX study help, or study guides and tips and blogs and things like that, I think that those will all help on any of those extra exams that you guys might have to take. Thanks, John. John says baby 2 changes everything. So he really has been pumping me up for this whole, you know, toddler and a newborn thing. So I'm not scared at all. Besides all this junk in my house with nowhere to go. All right, so does anybody else have any questions for us? I've transferred to another nursing school. Sarah, that's awesome. Life does happen sometimes, but you know, good for you that you're transferring to another school and you're going to keep going for it. That's awesome. So does anybody else have questions? Anybody have any cool stuff that happened this week in clinical, or anybody graduating this week? Taking NCLEX soon? Nothing? You guys are quiet tonight. You guys were much more talkative last week. Oh, John wants me to tell you about the Mnemonics podcast. So we have a nursing mnemonics book. It's been out for a little while, and we're kind of revamping it, and we're adding some more mnemonics to it, and we've started a mnemonics podcast, which is pretty cool. It's really easy. Sorry, I'm pulling it up on my computer. To listen on the road as you go. There's the link for it. I was just pulling it up on my computer too. So this is our new mnemonics. Let's see if I can turn my camera around. Podcast. So it kind of goes over just different mnemonics. It kind of gives you an easy way to remember things. And like I said, easy to listen as you go. You don't have time to sit down and read the book. But you're driving to and from class or to and from work. It's really great, easy listen. They're not very long at all. This one is 1 minute and 30 seconds. So again, super great tool that you can listen on the road and listen as you go, and just another great study tool for you guys. There's also other podcasts on here. If you guys haven't checked out all of our podcasts, they're all on our website, or you can actually find them all on iTunes, or if you have I think it's Google Play on Android, you can find them all on there just by searching NRSNG, and it should pop right up. So there's podcasts for nursing school struggles, for med. We have a Med of the Day podcast. That's our Med Master podcast. That kind of goes over a med each day, like it kind of says in the title. There's a question of the day. It kind of will go through different NCLEX questions and discuss the answer with the rationale behind it. The Lab Values podcast, that's something new too. So I've been getting a lot of emails lately of students struggling trying to remember lab values. So I've been pointing a lot of people towards our Lab Values podcast, because you might not always learn from reading the book. So sometimes listening to it just from a different voice than your teacher, or getting a quick refresher, it's a really great tool. And then the nursing mnemonics again, which we kind of already went over. So it looks like we got some more questions. Sorry, reading. All right, so Jamie is a new grad starting the job search. Clinical experience was mainly done med-surg floor in a small town hospital, limited patients. Any advice after getting hired? Honestly, lots of nurses feel this way after getting hired for their first job. Like, even if you've worked on a ton of different floors, you still don't get that full experience that you do as a nurse when you're just working as a clinical nurse, in clinical. You know, you're following a nurse around. You get a good experience, don't get me wrong, and you're not going to be totally clueless. You'll know the basics. But when you get on a floor, usually they have like some kind of a preceptor program for new nurses where they will have you follow a nurse around and have you take extra classes and really kind of immerse you into the specialty that you get hired for. So I wouldn't be too worried. I'm sure that you know more than you think you do and that you're giving yourself credit for, Jamie. So honestly, get the job, get on the floor, and they will most likely have some kind of a program to kind of immerse you into the floor and into the specialty. So don't freak out. Just you know, keep studying while you're searching for that job, and waiting to take the NCLEX. Worry about passing the NCLEX and getting that job, and then once you get the job, I think that you're going to do amazing. They wouldn't hire you if you didn't think you could. So James says, nursing school has caused me a lot of stress, as it does everyone. I started Lexapro and my grades have dropped. I'm still passing. I'm bringing my GPA down. I can't live with the anxiety I was experiencing, though. I just can't seem to find a happy medium. Nursing school can be stressful. Lots of people go through, ups and downs. And if nursing school and nursing is still something that's your dream, we say don't give up. It's hard to find a happy medium, especially when you're starting a new medication. As I'm sure you know from if you've taken a pharmacology class and learned about all these meds, sometimes it takes a while to kick in, and for your body to just kind of get acclimated to it. And hopefully once that happens, it'll kind of even you out. But if you're still feeling that way, maybe talk to your doctor, or find somebody you can confide in and see if there's something that you can do. So Stacy says she finished her first year ADM program in Massachusetts on Friday. Congratulations, that's awesome. And your second year starts in September, med-surg and psych. So it seems like you're excited about that. That's awesome, Stacy. Congratulations on getting through your first year. That's great. And take a nice little vacation until September if you can, if you don't have any classes. We do recommend studying over break just so that you don't, forget everything you already learned. And it doesn't hurt to get ahead in your med-surg class either, because there's going to be a lot of information there. So if you have time to, browse through things or get your books early, it doesn't hurt to start reading early. Chris says he's always wanted to do ED, but you've been offered a position as cardiac ICU step down. That's where I started. It's a good floor to work on. Did find it to be very fascinating, but as a new grad, I'm afraid it'll be too much too fast. So that's kind of my area of expertise, Chris. I started off on an ICU, or a cardiac step-down unit, basically. It was a telemetry unit. We worked really closely with the CVICU, which was right next door to us. It is a lot. It's a busy floor to be on, at least in my hospital. Lots of admits, lots of discharges. We also had a lot of other physicians that weren't cardiac physicians that really liked our nursing care, so I got to see quite a bit of different things besides just cardiac patients. But I think it's an awesome floor to start on as a new nurse. Not only that, but if you've dreamed of working in the ED, I think that cardiac is a really great place to start as well, just because you're going to get those basics down. You still get a lot of the med-surg type experience. A lot of people say go med-surg first as a new grad because they think that you gain a lot of experience there and you see a lot of things and you're able to use your skills. And I always said that cardiac, I feel like, is the same way. You can use a lot of your skills on the cardiac floor. You really fine-tune your assessment skills there, your critical thinking. You have to think on your feet a lot, obviously. If you're having, you're prepping a patient for open heart surgery, or you have a patient come in who is having chest pain, you know what I mean? They're thinking on your feet. You have to be quick to make decisions. And if an ED is somewhere you want to end up, I think a cardiac step-down unit is a really great place to start. I think that could be a good transition to either going into the ED eventually, if that's something you still want to do, or even moving up to the ICU if that's something you're interested in as well. Cardiac is a really awesome place to start as a new grad. Like I said, it is a lot going on up there, but I don't think it's any more than you would see in the ED. So if the ED is where you want to end up, cardiac's a good place to start for sure. Any tips for interviews? From Brianna. So for a nursing interview, we're kind of going to do a whole nother, I think, series on interviews, because I think it's really important, and I don't think that nursing schools really touch on interviewing or helping you find your first job. So I think that's something kind of important to go over, because I think nursing world interviews and things like that are a lot different than, like, I came from the business world, and I found it to just be a very different experience in the nursing world, like what to wear and what kinds of questions they ask. So as a new nurse, you'll probably get some more standard type questions just about your schooling and any experience you had, like clinical floor experience and things like that. So honestly, just answer those to the best of your ability. They might ask you things like, oh gosh, I'm trying to think, like how you were able to help out somewhere, like you were in a tough situation and how you were able to help out. So just honestly be honest with your interviewer. Don't get tripped up on questions. Don't try and make things up. Just be straight and honest. The biggest thing I can say about after an interview, like after they ask you questions, is it's important to ask them questions as well. You want to know that the floor you're going to work on is somewhere you want to be. So important questions that I think there are to ask would be like, what's the biggest problem you see on your floor, and where do you think I could help? Or you can ask something like, do you have any questions about my qualifications or any concerns about my qualifications as a nurse on your floor? That kind of gives you an idea of where you stand in the interview process, and if there's any doubt in your ability to be a nurse on that floor. Hopefully the interviewer would come right out and tell you that. And this would be if you're interviewing with the hiring nurse manager on that floor. A lot of times you'll interview with HR first, and then you'll interview with the hiring nurse on the floor, and HR is going to ask you a lot more basic type questions than the nurse manager probably will. The nurse manager probably wants to know you as a person a little bit more, and how you're going to fit on that floor. And you want to know that you can fit on that floor as well. So don't hesitate to ask questions about the floor. Ask about their preceptorship. When you get hired, are there classes that they're going to have you take? Do they educate you more? Or how long is their preceptorship? Do you get to be with a preceptor? If you're going to be working nights, do you get to precept on days as well as nights to kind of see both sides of things? Or do they only have you precept on the shift that you're going to be on? Do you precept with only one nurse, or do you get to precept with multiple nurses? I think that precepting with multiple nurses is kind of nice because you can kind of see how different nurses do things, take bits and pieces from each of those nurses and kind of form your own style. So I think that those are all really important questions to ask during an interview, just to make sure that you're ending up in the place that you want to be and that you're going to be happy there. You don't want to get stuck somewhere just because you were looking for a nursing job and really wanted a job and get stuck somewhere that you're not going to be happy with. I would also always make sure to send a thank you note. If you have the manager's email address, you can send it through an email. It's always really nice to just have a handwritten card too. You can send it to the address it to the hospital, attention, the manager's name, and the unit they work on. Just thanking them for the interview, thanking them for their time. It's always a really nice touch. So if it's ever between you and maybe one other new grad or another new nurse, you had that extra touch in saying thank you, and it kind of keeps you at the top of their head. And I always say to make sure you do that like literally right after the interview. So if your interview is at 1 o'clock in the afternoon on Thursday and it's over by 2, you go home and you either have that already written out and you throw it in the mail, or you go home and you write it out, or you send that email right afterwards. So I think that's really important to do, in the business world, in the nursing world, in any kind of interview that you are in. So that would be my advice for interviews for now. But again, like I said, we're hoping to do a whole episode on nursing interviews that I would be a lot more prepared for and have questions written and ways to answer them. So sorry I wasn't super prepared for that one. But like I said, hopefully a whole nother episode for that. Sorry, going ahead and reading down more questions. Well, it looks like that's it for our questions. So, unless anybody has anything else for me, we might go ahead and end this episode tonight, and we'll catch you next week. Next week, you guys will get to see John's lovely face instead of mine. He'll be talking, I think, ICU, critical care. I could be wrong. I don't have the schedule in front of me, even though I made it. So I think, again, he's going to be talking critical care, ICU. So it's a big question. We get quite a bit from students. One, because they're interested in it. A lot of students want to go into the ICU. Thanks, John. So yeah, definitely ICU stuff. That's what he's going to be talking about. So yeah, we get a lot of questions about that. So he'll be answering questions you guys have. He'll be talking about his experience, probably giving you guys tons of stories, and it'll be a really good episode. So make sure you guys tune in next Wednesday at 8 o'clock, and I will see you guys in a couple weeks. Have a good weekend. Bye.